During the Middle Ages, barbers played a significant role beyond their modern association with grooming. Known as barber-surgeons, these individuals were integral to both hygiene and medicine in a time when healthcare systems were rudimentary. Their duties spanned a variety of fields, from shaving and haircutting to medical practices such as wound care, minor surgeries, and general treatment of illnesses. The importance of barbers extended to religious institutions, particularly monasteries, where they were essential for maintaining the tonsures, shaved crowns, of monks. Clean-shaven heads and faces were not only a religious requirement, but also a mark of cleanliness and discipline. However, barbers also became indispensable to the broader public, especially in times of war and conflict. They tended to the wounded on battlefields, using their practical skills to suture injuries and amputate limbs when necessary. Barber-surgeons also performed bloodletting, a common medieval practice believed to balance the humors and improve health. Using specialized tools such as lancets and leeches, they drained blood to treat various ailments. Other procedures they conducted included tooth extractions, which alleviated severe dental pain, and the removal of kidney and bladder stones. Although these practices were often crude and painful, they filled a critical gap in medical care for people who could not afford physicians. In the 13th century, as medicine began to evolve into a more formalized profession, the distinction between physicians and barber-surgeons became clearer. Physicians, who were often university educated, considered surgical procedures beneath their dignity and left them to barbers. To regulate the profession and maintain standards, barber-surgeons began to form guilds. These organizations provided training, established professional standards, and monitored their members' practices. One notable guild was the Company of Barber-Surgeons of London, established in 1540 when King Henry VIII united the Barbers' Guild with the Surgeons' Guild. Over time, however, the medical profession continued to professionalize, leading to a gradual split between barbers and surgeons. By the 18th century, surgical procedures had advanced significantly, and surgery became a recognized branch of medicine. This change relegated barbers to their modern role in grooming, while surgery evolved into the specialized field we know today. The history of barber-surgeons highlights their adaptability and essential role in medieval society. They bridged the gap between hygiene and medicine, embodying the resourcefulness required in an era of limited medical knowledge and resources.